Hello, this is Dr. David Green, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 things to know about epidural steroid injections. Epidural injections were first performed back in the 1950s, so we're talking about over 60 years of clinical use in America. The purpose in pain management of the spine is to relieve the pain coming from pinched nerves. And this is most commonly performed with cortisone, which is steroid. And that's been the case for, like I said, over 60 years. That has not really changed. Now, the first thing to know is, what are the indications for an epidural steroid injection? Well, the most common is when you have a herniated disc with sciatica, and this is a disc pushing back. This is the spinal cord and then one of the nerve roots coming off. You can see that it's getting pinched, and the red indicates it's being inflamed. So that's a herniated disc with sciatica, which is pain down one of the legs from that. Spinal stenosis is when spinal arthritis causes bony and soft tissue overgrowth. It effectively leads to the same type of problem, but it occurs most commonly in multiple spinal nerve roots. And then another indication is when you have degenerative disc disease. Some people think, oh, it's only going to cause disc pain and epidural injection is not indicated. But that's not always true. If you have, let me just point this out here. Let's say you have a disc that doesn't have this herniation, but it's got a tear in it. That can spark up inflammation, and that inflammation can actually irritate the adjacent nerve root. So an epidural in that case can actually help very much. So the second thing to know is, how do they actually work? Well, cortisone is a hefty anti-inflammatory steroid medication. So when you inject it around this area, it doesn't fix this problem. It's not going to cure it, but it can really bathe it in soothing anti-inflammatory medication, and it can stick around for weeks to months, and it can slowly get resorbed, dissolved, so to speak, and it slowly dissolves, and it can provide pain relief for a long time, and then it can be repeated. So the third thing to know is that there are actually different types of epidural steroid injections. They're not all the same. There's actually 3 types. One is intralaminar. Actually, that's wrong. It's interlaminar. The next one is transforaminal, and the third one is caudal. So here's an interlaminar epidural. These are the lamina, these bones here. You see them up here and here. So essentially what the needle's doing is going between those. So it's interlaminar, and it goes through the soft tissue, which is not shown here, and then you inject the medication around the spinal cord, and it seeps around to the nerve root that's getting pinched and inflamed. So transforaminal is a newer type. That's the newest type of epidural injection. You can see it goes actually right around the area where the nerve root's being pinched. So the steroid goes right in this area, and it's been showing actually great results over the last decade. And the third type is called a caudal epidural. This is the bottommost part. This is actually the sacrum, okay? And this is the lumbar areas here. There's a sacral hiatus here, a little opening, where the needle goes through, and then a larger amount of steroid is injected, and it seeps up into these areas. So what's it good for? It's good for spinal stenosis, because you have multiple nerve roots being pinched, and that steroid medication can migrate to the areas and relieve multiple nerve roots at one time. The fourth thing to know is, what are the outcomes of epidural steroid injections? Well, there's been dozens of studies performed in the last couple decades looking at epidural injections. The problem with studies performed prior to that is that they didn't look at the epidural injections using X-ray guidance called fluoroscopy. And they also a lot of times didn't randomize patients. So that's why you see some studies that just did not show very much effectiveness. But overall, looking at epidural injections, 75% receive good to excellent outcomes. All right, I've seen some at 50%, I've seen some at 90%, but when you average all these studies together, 3 out of 4 patients are satisfied with the outcome. Here's a study that was in just last year. A prospective study of patients having radicular pain, which is pain down the legs, caused by degenerative lumbar spinal stenosis, found that after transforaminal injections, 3/4 of patients noted at least a 50% reduction in pain, almost 2/3 had improved walking tolerance, and 57% had improved standing tolerance at the 1-year follow-up. So this shows in a very good study that a significant amount of patients get excellent relief. So the fifth thing to note is that these injections are not approved by the FDA. And they haven't been denied either. They just haven't gone through the FDA approval process. And that's because they're used off-label, just like 40% of medicines in the United States. So when people say, oh, it's not approved by the FDA, don't have one done, they actually don't know what they're talking about, or they're trying to bias the patient. A lot of treatments on the market today work very well for indications that they were not initially approved. Now, to go back through FDA approval to get an on-label indication so that it is FDA approved is ridiculously expensive. We know they work. It's fine to use them off-label. So people who say, oh, it's off-label, therefore it's bad, that's just wrong, okay? The bottom line is that epidural steroid injections are a very effective treatment for pinched nerve conditions, such as spinal stenosis, herniated disc. It's an outpatient treatment, very low risk, low complications, much less than 1% of infection or nerve injury, and they can be repeated every few months. They're usually done as a cycle, 3 injections over about 6 weeks, and then a few months later it can be repeated if necessary. The top pain clinics in Arizona are Arizona Pain Specialists. They provide both medical and interventional pain management at 5 locations, accepting over 50 insurance plans: workers' comp, personal injury, PPOs, Medicare, Medicaid, and self-pay. The doctors are board certified, award-winning. They have pain doctors, chiropractors, acupuncture doctors, physical rehab. They also offer spinal decompression therapy. Visit us on the web at preferredpaincenter.com or call the number for scheduling at 602-507-6550 today. I'm Dr. David Green with the Arizona Pain Network. Your pain stops.